Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my producer, Lindsay, and we are streaming live from downtown Boise, Idaho. You guys know how much I love Boise, Idaho. And I want to welcome Dr. Ross Carter back on our show. We are going to be discussing continuous glucose monitoring. We've talked about glucose a lot on our podcast. We've talked about, we have a challenge coming up in July. We're going to do, it's called data-driven fasting, where you check your glucose and it kind of triggers, you get your what your trigger should be for eating, what your glucose should be before you should be eating. And it's a finger stick method, pretty easy. I'll be demonstrating that here in a few weeks, how easy that is. But it's, one of the limitations of a finger stick glucose is that it's a small snapshot in time. It only tells you what's going on with your glucose right then. So Dr. Ross Carter is going to talk to us about continuous glucose monitoring. There's been a lot of cool technology that's come along in the last few years, and he's going to tell us about that. So Dr. Carter, welcome to back to our show.
It's a pleasure to be here. Thank you for having me.
So tell us, continuous glucose monitoring. Tell us what that really is.
Well, continuous glucose monitoring is, which is nice though. What you call it is the definition. It continuously monitors your glucose level. So that's easy to remember. Thank goodness. So really, it's just looking at your sugar levels in your blood on a constant basis, where you can monitor it and see what happens to it throughout your day and throughout the night. So you can see what happens when you eat a food, whatever food, and see how your body responds to that food. Is it a food that you don't have a high insulin response, or is it one that you do? Or what happens when you go to sleep at night? Or is there a sugar level change? Is it going up or down, or what's going on? So in sugar levels really affect a lot of different areas, whether it be weight loss and whether it be your mood. So there's a lot of different areas that this glucose levels should be to be looked at to see how you're doing in each area, especially in weight loss, which is most common. But I use it a lot with sleep problems. One of the specialties I work with is sleep. And one of the areas that we look at is your sugar levels, especially when you sleep, because a lot of people have no idea, have never monitored their sugar levels during their sleep. So it's a good idea to find out, hey, is my sugar level dropping? Is it staying constant? Is it too high when I wake up? I mean, what's going on with that? So that's one of the primary areas that I use continuous glucose monitoring is for sleep problems.
So tell us how a low glucose or a high glucose could affect your sleep.
Well, one of the problems is a lot of people wake up at night, and when that happens, what could happen is you could eat something at night. It could be a high fat or high carb or high sugar, high calorie food, too much of it, and then during the night your body is metabolizing that, and then your sugar levels can start to drop to a hypoglycemic level, usually around lower than 70 milligrams per deciliter. And your body is going to have a response to that. It can, in a lot of people, it'll wake them up so that they move or they get up, and it just, maybe they'll feel hungry or whatever. But when your blood glucose falls too much, it can actually wake you up. And that's a common thing that I see is their sugar levels are really a problem. It's because they're eating the wrong foods at night when they especially go into bed. Ideally, the best way to do it is eat more than 3 hours before you go to bed. So if you go to bed at 10, stop eating at 7. It's a real easy, just cut off, no more eating, and especially avoid any alcohol or sugars or carbs, especially those type of things. Just keep those down on the low end at night. You want more like proteins and things like that, but just eat smaller meals at night.
You want something like protein or fat that's going to more stabilize your blood sugar, correct?
Exactly. You don't want spikes in your glucose.
Right. So, when we talk about blood glucose, we typically relate it to diabetics, but you're talking about using blood glucose monitoring for more than just diabetics, right?
Well, I recommend everybody know what's going on with their blood sugar levels, because many people have pre-diabetes. They could be pre-diabetic and not know it. When you wait till you have a major problem, that's really more difficult to help. Why not know ahead of time? You're like, hey, I have a tendency here to have blood sugar spikes when I eat this item or this thing that you like. And then you keep doing that, and eventually your body you're going to have a problem because of that. So I like to say this a lot, is that the cure to all health problems is never to have them in the first place. And so this is a perfect scenario where you're monitoring yourself of your normal body reactions to foods. And if you know up in advance, this is a problem for me, and maybe I should change it before it becomes a pathology. One of the things I talk about with aging is that the way we age is through metabolism, causes all this damage. The damage accumulates, and then eventually the damage gets to a pathology. But we can stay in damage stage and repair stage for a long period of time. And if we're repairing fast enough, then we don't get to the pathology stage. And this is similar to what we're talking about with your glucose levels. If you find out there's a problem, let's say you eat some, cake, all right?
Yeah,
you
right.
go and have a cake at night, and you see how it spikes out your blood sugar, and that's okay, because your body is like, okay, it's all right, I'll let that happen, but it doesn't cause a pathology. But if you're eating cake all the time, your body is going to start to have develop an issue because of that. So for me, when I would do them for myself, my sugar levels, you don't want to spike more than I think 30 to 40. If it's over 40, then that's a big spike, and that's something you should address. But I noticed that I'll have like a snack or something, and everything was fine. I'm a very healthy eater, but I thought that I could have almond milk, because I don't drink regular milk. Almond milk with some, I don't know, Cheerios. I think I had it just as a snack. And man, that's the spike of eating just a little bit of cereal with almond milk, which is low glycemic. It just spiked way high. So for me, I wouldn't have known that had I not had a monitor on. I would have thought I'm doing something healthy and this doesn't cause me problems. But then I realized, oh, wait a second, what I'm doing here is not healthy. This is not good for me. So I have to stop doing that. So that's exactly what I did. So I replaced that with other snacks or different things that didn't cause that. And I'm like, okay, so I can do this instead. But I wouldn't have known that, because it wasn't unhealthy really. It was just my body response was unhealthy response, I guess you could say. And everybody has their own responses. I mean, some people respond completely different to situations. So that's why it's really good to see what your response is, what's happening with you when you eat foods. And because it's going to be different for everybody. So if you have a monitor, at least you know.
Right. And I know I've been doing just a standard finger prick blood glucose test for the last couple months now. Mm-hmm. And I am surprised about what some things do spike it. And specifically, I was checking before I eat, after I eat, on awakening, all that. And, coffee with creamer. We're talking about half and half creamer. I mean, it spiked my glucose. And people wouldn't think that it would. I mean, right? And especially when you talk to the keto people. Now my body is just maybe a little bit different, but it's important to know. That's why this is so individualized. It's important to know what your body does. Now, it wasn't spiking anything more than 40 points, but I thought it was going to barely raise it. I mean, we're talking, a tablespoonful of creamer. And, I didn't do it a whole bunch of times. So I don't have data to back it up, but that's where continuous glucose monitoring will be nice, because I'll try to stay consistent with my diet and just see what happens
Change your
during that.
creamer out and see if
Eh,
you try something else that gives you
right.
that creamy taste that doesn't cause your blood glucose to change.
And that's what's cool about, the technology we have now that's fairly inexpensive, whether it be blood glucose monitoring with
Yep.
the finger sticks or whether it be continuous glucose monitoring, which we'll get into some of the details of the equipment and the pricing. But, it's fairly affordable and it's really cheap preventative medicine, even if we're not
Absolutely.
diabetics. I
Yeah.
mean, so I'm glad I did it.
Yeah.
And it also makes you realize how resilient your body is and how much
Mhm.
reserves you have. I mean,
Yeah.
especially when I'm training hard and I'm eating a lot of carbs because I am a mountain bike racer, so I'm an endurance athlete.
Mhm.
It takes more than 24 hours to deplete my glycogen and get my glucoses down. I'm taking this week off and I notice my glucoses are finally coming down because I'm eating a lot less and I'm training a lot less. So, and let's speak of training. So, exercise. What's exercise going to do with your glucose? And I know that's a pretty general term, but tell us, what's exercise going to do to your glucose? People might be surprised. I know I was surprised. I've been checking it before and after exercise.
That was actually surprising for me because of how it didn't really change my glucose levels, which I thought was really weird. I thought my sugars would change while I would do, let's say, a 5 mile run. That's what I normally do every morning. So every time I would check my sugar levels, it really did not. It didn't have much of a change. But I think that's because I'm a relatively healthy person, but that may not apply to everybody. Some people's sugars can change dramatically, but for me, fortunately, mine stayed pretty level, and I don't crash. But I'm very careful in what kind of carbs or anything that I take um, in the mornings before I go run. So I've noticed that, like, if I have something like, say, some fruit or something before I run, I have a harder time initially when I first start getting my breath. But if I do it more in a ketotic state, I tend to it's easier for me for some reason, even though I'm hungry, but I'm still able to run better and longer in more of a ketosis state than I do in a high carb state. But that's just the way I run. Now,
Right.
my friends are
Everybody's
completely
different.
different.
Right. And I think that's what's so important about this data is my nephew is a type 1 diabetic and he was a very competitive wrestler in high school.
Mhm.
And he would check his glucoses 50 times a day when he was, training hard in wrestling. He would check it before and he would check it after the match and all that. And my brother, it really helped him dial his glucose in. And Dr. Ross, in a lot of ways, his type 1 diabetes kind of gave him an advantage because most people didn't know what their glucose was before or after the match. So they didn't know what to eat and when to eat and how much to eat. They really didn't know, whereas he knew what made him perform well. And I think
Right.
that's one of the things that we can take from this data. If you get enough data of yourself, is like, what did happen during your run? You did a fasted run better. A fasted run is better than eating fruit beforehand. Now, if that run was 15 miles instead of 5 miles, it might
Yeah.
be different. I think, and I know with my exercise, I'm surprised it doesn't change a lot, but it really depends on intensity also. And
Yeah.
it depends on duration. I will tell you, I had a bike ride a few months ago that was a 5 hour and 15-minute bike ride at moderate intensity. So zone 3 heart rate average. And by the end of the ride, the only thing I had to fuel left, I didn't have any plain water. All I had was my sugary drink. That's all I had. And that
Yeah.
was my part of my fuel for the entire 5 hours. And I was not feeling really good the last hour. I mean, I was about ready to vomit. I wanted plain water, but I didn't have plain water. But I knew I wasn't, my life was not in danger at all. Anyway, after the ride, my blood glucose was 145. It's the
Wow.
highest. Yeah, it's the highest my blood glucose has ever been. I like this data because now I know that I probably overfueled. I had too much carbs. Um,
Yeah,
And
it's weird, isn't it?
yeah, I know. And I was burning, I'm burning probably 750 calories an hour, and I was only
Yeah.
intaking probably about 300. And but you got like glycogen stores, you got fat stores. Your body is very resilient at getting gluconeogenesis.
Yes.
But here's what's really interesting. I didn't feel like eating afterwards because I was nauseated. My blood glucoses were so high. So I waited 2 hours. I couldn't eat. I couldn't eat solid food. I couldn't even drink any calories. I did take in some electrolytes.
Right.
My glucose 2 hours later, 77.
Wow.
It's actually
Dropped
the
a lot.
lowest. Right. It's actually the lowest glucose I've ever had since I've been checking it. Now, here's what I find interesting about that is that usually my body, when I'm training, it tries to keep my glucoses up, and that's why they don't spike or they don't come down really low during the actual training ride, because it's trying to make glucose because I'm going to burn it. 2 hours later, when I wasn't burning it anymore and I wasn't eating, my glucose crashes. And I can tell you this, I do know this, that if my glucose would have crashed like that during that race, I would have bonked, and I might not have been able to finish. So that's one thing I'm really interested in is what is my glucose doing during a 5-hour ride? I would love to know.
Good. Yeah.
How do we fuel that ride? Am I fueling too much? Do I need more? How do I feel? And you have to do a few of them to find out what works the best and how your blood sugars respond. But do you have any comments about that on exercise?
Well, yeah. I mean, what you were saying though, you did it with the finger prick thing.
Correct. Before and after. That's all I knew.
Right.
I didn't know during.
Yeah, that's difficult. But if you could do it while you're going through your ride, so here's how it works, because a lot of people might not know how one of these, at least the one that I use, works. So it's a device that goes on the back of your arm, right? It's just stuck in. It doesn't hurt, which is, I thought it would hurt, but it doesn't hurt. You put it in the back of your arm, it just stays there. You cover it with like a big bandage. There's like a bandage that keeps the water from getting in and things like that. And it just stays there for 2 weeks. Now you'll have an app, a little app on your phone, and all you have to do is turn on the app, and then you just touch or get it close, and just it'll go beep, and then at that moment it will show you from the previous period of time to that point. It'll show you the whole graph, not just one point, and you can put you can type in a little a dot, you can put a little label there and say, okay, feeling tired or something, or you ate something, whatever it is that is happening when you do the scan, or nothing. You don't have to, but you could put a tag there. So if you're on your bike ride and you're in an hour, you could just tap it and go, 1 hour in. Or let's say you're crashing, you're like, tap it and say, I'm dying now. And then you could actually use that information on an instant basis. You don't have to stop and finger prick. You just literally would take your phone, tap it, and you'll know where you are in your sugar levels. And so that's a great way to do that, is to always have that available. And it's simply something simple to have access to.
Now, if you don't mind, let's talk about brand names. Are you talking about the Freestyle one?
Now, I use one that's called Nutrisense. It's Nutrisense. Nutrisense. That's the one I like, because they've got like a 2-week trial. They call it a 2-week trial, assuming that they want you to stay. They do want you to stay on for like a long time. But for me, it was just to get the data of my normal life. And so I tried it for 2 weeks, and that was the one that I preferred. Yep, that's it. And you see that little Band-Aid she's got on the back of her arm? The little black thing?
That's it, huh?
That's just the covering. It's like it's just a regular circular Band-Aid. The actual disc is a little tiny white disc. It's really small. And you do it. And what's great about this is, first of all, you don't have to go see a doctor to get this. You can order this online. They'll send it to you, and it looks like a little circular stamper, right? And it gives you really clear instructions. You take 2 pieces of plastic, you click them together, and then it's ready. And then you just put it on the back of your arm, and you just like that. You don't feel any pain. which, because if you look inside, there's a little needle like thing in there because it has to pierce the skin, but you really don't feel it. You do it real quick and bam, it's on. And you're just like, wow, that was easy. You put the band, it doesn't bleed. You put the bandage on, you keep that there and keep it, semi-dry, and then you're ready to go for 2 weeks. So that's how I did it. I did it a couple times just to really look at the data. And I was really happy with the results. And the cost was, I think you can get it. It's like $175 or so, and there's discount coupons online, so you can I think you can get it for $150 is what I wound up paying. So,
and that's for a 2-week trial, basically.
What's that?
That's for a 2-week trial, basically.
Right, which was what all I needed for is just wanted to do it for 2 weeks. I did it twice though, so now, really.
Now, one of the disadvantages I heard about this one, and there's a few of them, that's why we're talking about this, is you have to take your phone and touch it or scan it right over that to actually read. I know there is one out there where it sends data to your phone automatically without touching it. Because I can tell you, what happens if a patient's not really compliant. I can tell you in a 5-hour bike ride, when I'm really concentrating on biking, it would be very difficult for me to, actually touch the phone to that while I'm riding without stopping if I don't want to stop, right?
Sure.
So do you know of other brands where you don't have to do that?
Well, no, I've never used another one that doesn't have it exactly like that. Most people, when they're doing it just because for regular food, that's not too much of a chore. So, and I don't have another one that I utilize that has the ability to do it without getting you don't have to touch it, but it has to just be in the vicinity of the device.
Right.
And so I don't know of another one that would be that would work that way, but I'm sure there are.
Yeah. I can't remember the name. I know the Freestyle one is the one that is a lot like the Nutrisense that you're talking about. It you have to wave your phone over the device to actually get the data, and we're checking out to see if we can find out what the other the name of the other brand is.
It's got a little Bluetooth sensor thing in it, right? And a battery. So if it's projecting the information to the phone and it's a distance, that means that Bluetooth signal that's in your arm is going to be really strong. I wouldn't want to get the Bluetooth, encompassing my body too much. So I prefer it being just a little signal, not like a giant one.
Yeah, and I totally agree. I think we found it. Lindsay, what'd you find out? Dexcom. That's what it is right there, Dr. Carter. The Dexcom is the one that it and I don't know the details of it, but you don't have to touch your phone or swing your phone near the device. It automatically sends data to your phone automatically. And I don't know if it's programmable about if you can do it, set it to send glucose every 15 minutes or what, but we can definitely get some more information on that. But I know, so there's at least 3 on the market. Go ahead.
Yeah. I see a subscription. It's $300 a month. So it's rather costly.
Right. And I don't know if they have a plan kind of like they do with the Nutrisense that you can just do it for 2 weeks. I'm not sure about that. So that's kind of why we're having this discussion.
It says here that you'll get 4 sensors. So they only last a week. So there are 4 sensors that come with it, and it's it's $300 for a month. So it doesn't seem to show that you have some short term. So it just depends on how long you want to wear it. I'm sure they're all doing the same kind of thing here.
Exactly. Right. Absolutely. And that's why we're talking about it, just to get the advantages and disadvantages of each.
Right.
Mainly I think what's important is, to do something and get started, trying it at least. And and I know there's some debate out there about, is it overkill? Well, is it overkill to think about our health? I suppose it's.
Why would that be overkill?
Exactly. That's how I look at it.
That would not ever cross my mind. of having a monitor just for a period of time to see how your sugar levels are when you eat is overkill of anything, you know?
Yeah. And I will tell you this, I think from, me over the last couple of months, doing the finger stick checks, I probably spent over $150 checking my glucose. Because especially when you first start doing it, when you want to see what happens when that coffee with creamer, you want to see what happens before, you want to see what happens after, you want to see what happens a half hour after, an hour after, 2 hours after, right?
Yep.
I mean, so those strips can start adding up, although they're very, very affordable when you think about it, relatively speaking, over the long-term health
You couldn't
consequences.
do that while you're biking, though. I'll tell you that.
No, I wouldn't want to do that one. No, I would not want to do that while I'm biking. That's for sure. And that's why I'm really curious about this, because I want to know what it's going to be when during a bike ride, and I haven't really seen that yet. And how does fueling affect it? How does intensity of the bike ride affect it? I think
here's the thing:
you can really change your performance.
It'll give you the graph over time. Even if you don't click on it during your event, it'll show your graph over time. And if you know what time you're wanting to look at something, you can look at it on the graph. So you don't actually have to touch it then.
I see what you're okay. So help me out. It's this Nutrisense one is continuously monitoring your glucose. What data points how often will it plot out on the graph what your glucose is? I mean, it's not every second.
Whenever you activate it, every time you activate it, it'll give you the next scan. But
which means you have to touch it to your arm, touch it to the device. That's when you activate it. That's how you activate it, correct?
Right. It'll start at that moment, and it'll continue to record data. Then you'll touch it again, and from the moment you touched it from the first time to the next time, it'll show you the whole graph throughout the period of time.
Okay. Well, thank you for clearing that up. I thought it was giving you spot checks when you touched it. Every time that would check your glucose. Every time you touched it.
No, continuous. So it'll show you for an hour what's happened.
Okay, so perfect. So when you mean continuous, so I mean obviously there's some kind of timing. It's not every second. It's not every 5 seconds. Probably is it every 10 minutes? Is it every 5 minutes? What is that graph over that hour?
I don't know. It's pretty frequent. I would say maybe every minute or two. I mean, it seems pretty frequent.
Right. So definitely enough to see what's going on after you eat. Immediately after you eat, everything. Okay. So that actually is the best of both worlds then, because from what I understand, the freestyle one, it only will check your glucose when you wave your phone over it.
Oh, so that's like a finger stick.
Kind of, except it's easier because you've already got stuck. So you just take your phone and wave over it. Yeah.
This will give you the whole period of time. It'll show you a whole graph from.
So it starts and stops when you put your phone over the device.
Well, it doesn't stop. It starts when you put it over, and then it'll give you an update at that moment.
I see. Yeah. Oh, I see. Okay. Yeah, it'll send a graph to your phone or whatever, but it's continuously monitoring every 5 minutes or whatever you're saying all the time for the 2 weeks.
Right. That's why it's great at night when you sleep, because you can look at, hey, what happened at 2 a.m? Oh, look, I have a drop in sugar there. Did I do something? Did I get up and eat something? What happened?
Well, it looks like you've already done all the homework, and that's why you recommend it to your patients. It sounds like the Nutrisense is the way to go.
Sure. It's the best one that I've found.
Right. I mean, for what we're talking about, where you only need it for 2 weeks, and you're just kind of seeing how your glucose respond, for average everyday individual.
Let's say you want to lose weight. I mean, there's a lot of people right now that want to lose weight. This is a great way to help monitor your sugar levels when you're trying to lose weight.
If your sugar is high, you might think you're hungry, but you shouldn't be hungry in theory, because you have
not only that
floating around your body.
Is the food good for you?
Well, yeah, right. Yeah. Correct.
We think maybe it wasn't as healthy as we thought it was.
What are we missing out on continuous glucose monitoring? What else should our listeners and viewers know?
I mean, I think we covered it pretty well. It's just really, especially it affects so many things. Your sugar levels affect your hunger levels. It affects, your weight. It can affect your sleep. I mean, your sugar levels are really important information to know that most people never even think about addressing. And this is a monitor that can just give you the whole picture of what's going on with what you're eating and how your body is affected, because it affects your mood, it affects everything. So it's just an easy way to really give yourself something to monitor how your health is doing.
Awesome. Well, you've definitely achieved our goal today of educating and empowering our listeners and viewers to take charge of their own health. I mean, this is just yet another tool in their toolbox. So I appreciate you doing that, Dr. Carter.
You're so welcome.
And I want to ask you, like we did when you were on our show last time, tell our listeners and viewers what you have a passion for.
What I have a passion for? Well, you know what? I have it right here. My passion is my book. I just, there, can you see it?
I can. Yeah.
There it is. So this is what I'm actually updating it, but I'm releasing, and I'm excited about, it's called Rethink Aging, and it talks about aging. And because most people have no idea what aging is, we say the word a lot, we're aging, but what does that really mean? And why do we age? And what's the science behind it? So that's what I cover in the book. And if you know what causes aging and us to develop disease processes because of aging, then there are ways to slow, pause, or even reverse some of those things so that we can stay healthy longer. My goal is not to live to be, a 90-year-old man disabled, with a wheelchair. That's not where I want to be. I want to be where I'm at now at 90 years old. I want to be mobile. I want to be coherent. I want to be healthy, because no one wants to live in a nursing home as they get older. They want to be able to take care of themselves and enjoy the life that they have. And usually when we're older, we tend to have a little bit more money to be able to do that. But if we're stuck because we physically are disabled, we have disease processes, we're in pain, the joy of life is sucked out. So my idea and my purpose is really to help people understand the processes of what's going on in our bodies and why it is and how to slow that process.
And of course, we didn't discuss it, but we discussed how important glucose is. But, glucose is inflammatory. High glucose, let's say this. I mean, we would die without glucose. But high glucose is inflammatory to our bodies. And that's one of the reasons that diabetics, that have out of control glucoses don't live as long, and they aren't as healthy, because it can cause inflammation. Now, from what I understand, it's not necessarily the glucose that causes inflammation. It's hyperinsulinemia. It's a high insulin that really can really cause the problems long term. So, obviously a stable glucose can help keep the insulin stable. So,
right.
So Dr. Carter, if people want to get a hold of you, what's the easiest way to get a hold of you? They have questions.
Sure. They can just go to my website, which is just my name, drrosscarter.com. So it's drrosscarter.com. And and you can get in touch with me there, or my phone number is 561-962-1231, or you can email me at drrosscarter@regenerativewarrior.com, as you can see, hopefully on the screen.
Awesome. So we need to have you back on and just talk about sleep. I think we could discuss.
Oh man, that's a big one.
Yeah, right. And talk about.
We haven't done that. We didn't.
No,
do that
we
last
haven't.
time?
We haven't. And
I have 10 step 10. Listen to this. I'll give you a little preview.
Sure.
I used to be addicted to sleep medication for years.
Yeah.
For years. I had to learn. I learned from about 50 experts around the world because of my show. I got the chance to talk to experts around the world and learn the secrets to restoring my sleep, because in any medical training I had, it never talked about how to fix that problem. And which is so weird to me is that we are born and tend to know how to sleep great. And then as we get older, we tend to lose that. It's a weird thing, but sleep is something that can be trained. Yeah, isn't it weird?
Good point. I mean, we don't have any problems when we're kids or babies sleeping. That's interesting.
I'll give you something funny you can look up as well. Did you know that every year that we conduct a sleep study in the United States? Did you know that?
Okay, explain.
Every single year, there's a sleep study. What it is, it's called daylight savings time. And we lose and gain hours of sleep, right? Or gain hours. So what they found was, here's what the study shows. When we lose an hour of sleep, the next Monday, the day after, there's a 24% increase in hospitalizations from heart attack.
Wow.
Right? So they thought, well, is it coincidence? Or let's look at when we gain an hour of sleep. And so what they did was they looked at the hospital data. And you can look this up. This is not me making it up. 21% decrease in hospitalizations from heart attack when we gain an hour of sleep. So what does that say? If you don't sleep, it could kill you. So you need to learn how to.
Yep.
And
yeah. Go ahead.
So one of the steps I talk about on sleep is sugar levels, and that's why this is why I use these the continuous glucose monitoring, because sugar levels are really important and vital to know when you're sleeping, and there could be other problems. But there are 10 things that I made it really simple. 10 things that can take you from not sleeping well to sleeping like a champ, like I do now. But
don't tell us. Let's save it for the show.
I'm not going to tell. I was an insomniac for years. So if I learned how to do it and I could fix my own drug problem that I had and get off these addictive medications, which a lot of people are taking like candy, then I can show you how to do it too.
Awesome. Well, yeah, let's not give that one away. Stay tuned for that. Moral of the story, get more sleep. Literally what Dr. Carter just said, we will die without sleep. We've said it before on this podcast. We'll die without sleep before we'll die without food.
That's true. You're right.
That is just true. So stay tuned for that. I'm excited to have you on about sleep hygiene. That's awesome.
Sure.
So Dr. Carter, as always, thank you. We look forward to having you on again. You've been listening to Health Solutions with Shawn and Janet Needham. Tune in Monday, 12:30 to 1:30. Producer, who do we have on? Remind me. Yeah, we have Dr. Mary Tolly Bowen on. She is the owner of a cash-only surgery center. We've talked about cash options many times when it comes to healthcare, how you can save money. We've used the Surgery Center of Oklahoma as examples many, many times. And we are going to talk to her, and she's going to tell us, and just speaking of sleep, she is an ENT doctor, an ear, nose, throat doctor. She specializes in surgery at ear, nose, throat, and she also does sleep medicine. So speaking of sleep, we'll be talking a little bit about that too with her. So tune in Monday, 12:30 to 1, Health Solutions with Shawn and Janet Needham. Thank you for tuning in. Thank you, Dr. Carter.
You're welcome. Thank you.